talk about evaluating your patient for pubic pain. This is a game changer if you don't address this already in your practice. So why this happens is the perfect storm, right? 4 out of 5 people have a short leg, either anatomically or because their glutes are too tight or the muscles in their hip are too tight, and that contracts their leg. When you contract the 2 pieces of your pelvis, if the one side is off, right, if it's not a solid base like your house, if there's a crack in the foundation, that is going to make the pelvis or the pubis unsteady because it's sort of like, where are you going? So it's off center, it's cockeyed. At the same time, unless you're an athlete, with your first pregnancy, it's typically a second pregnancy thing, that the first baby that Jackie had sort of paved the way. Whenever I give a talk and to the other doctors, what I show is a perfectly tight trampoline. Jackie doesn't have a perfectly tight trampoline anymore. She has some snow that has stretched out the trampoline. So the first baby stretches the pelvic floor out. If you can think of plastic fruit bags when you talk to your patients that stretch, they don't go back, right? So that's why patients feel the baby faster, they wear their maternity clothes faster, they have symptomatology faster. So when the pelvic floor stretches, the pubis thought it had a break for a couple weeks, and now the pelvis is off, probably from the injuries and the nature of the first pregnancy. So that's a lot of stress. So it's cockeyed, the pelvic floor is stretched, so that's more weight. You can think if you have more weight at work or more things that you needed to do, the pubis is like, what the heck is going on? And is basically bracing itself. When the body's under stress, it puts down more spasm because it's like trying to fix itself, just like you do with your own leg. So it spasms where it constricts and contracts so that it stabilizes itself. That is painful. As it's trying to do that, if you can think of it like sweating and grunting, and it's like, I'm under so much stress, it starts to break down and your body starts to show wear and tear. When I explain this to a patient, I explain it's almost like a shin splint. The bone, if you remember from anatomy, is completely different from other bones. The pubic bone is very similar to the ribs and also the shin. So it has a lot of blood in it, which is great for healing. It's very quick to heal, but it's also very quick to bruise. It's also in sensitive areas that could have mortal harm. So again, it's a very sensitive area. The body doesn't want you to touch it. When you touch this area, sometimes it's red, sometimes it's swollen, but what I'm looking for is not along the pubis, areas of stress, that you start to see a stress pattern, and how you see that is tight muscles, tight ligaments, and also the presence of these knots. What the knot or trigger points feel like when you're palpating them is like a vitamin E capsule that's filled with a little bit of fluid. If it's really ticked off, you're going to feel there's fluid all around it. Your hand is going to be hot from this area. So when you evaluate this, it's extremely important that you have a good mindset, that you're not creepy, and that you explain everything before you do it. I always say to patients, I talk extremely fast. But when I'm in this area, this is such a hotbed, no pun intended, for a lot of sexual trauma, or people that are shy about this, or they've had a bad experience, or you're near their baby. It makes them extremely nervous. So it's extremely important that you are confident, that you're competent, and you know what's going on and can explain that in a human way. And then you ask permission at every step in the way. So the first thing I'm going to do to evaluate your pubis, you doing okay on your back?
Yep.
Cool. Is I'm going to bring her knees up. So typically, if a patient is not symptomatic in my practice, I don't touch this area. It's not fun. So why do it? It's not going to do any clinical benefit. But if the patient is having lightning crotch or pain down there, then I'm going to ask permission. Is it okay if we evaluate you? First thing I'm going to do is bring her knees up. This is part of my standard evaluation with every patient. So I'm going to have her open her legs. Before I have you open your legs, I'm going to warn you that you're going to feel it in your SI joints, or I call them the magic Mike spots, where there's dents on the back. So I'm going to have you open. Especially if she's having a lot of back pain, I'm going to warn her because she's going to be like, ooh, I didn't expect that. So predicate that. So I'm going to fling you open for me. Any pain in the back?
Not really.
Okay. So now I'm going to have you squash my hands and push your legs together. Any pain with that? Now, when I'm doing that, there's a hesitation or a wobbliness of this leg, right? So I'm going to bring her in again. I don't know if you can see that. So this one's a little bit weak, right? So the next thing I'm gonna do is it okay if I touch this area? Okay, so it's like right where the top of where your panties are gonna be. So I'm gonna do is I'm gonna come from the outside. At any point you want me to stop, let me know. And again, before we've talked about if you're a male provider, a good idea would be to put your hand here and have her touch the area, right? If she can, over her belly, which Jackie can, but I would push down for her. But if you're okay with it, I'm going to touch you right here. If at any point you want me to stop, let me know. What I'm going to do is work from the outside. So from the ASIS, I'm going to work down where the top of her panties would be, right? So I'm going to go right along here, and I contact the bone. The patient's like, oh, I thought that was a bone. That's a bone, but on top of it is a whole nest of these knots. So as I approach the center, right, the center where the two pieces of the innominate bones fit together, there's a disc. So when I approximate that, that's where the stress point is. That's where it's going to show the most stress. So right in here, do you feel that, Jackie?
Yes.
And then it wraps up. You don't just stop there where it's flat on. I can go above her her pubic. I'm going to go on top of her pubic bone right here. Feel it? Yeah, it's very sensitive. It's not fun. So I'm going to, but it's up here, and then I'm going to evaluate underneath. I'm sorry, Jackie, right here. Okay, do you feel that?
God, I'm tight.
Yeah, yep. So we're going to evaluate the other side. And again, in my practice, I don't mess with this unless the patient is, this is not just something to do for fun, or it's going to be any clinical benefit for her pregnancy or helping her have a better pregnancy. It's just if she's symptomatic. So I'm going to come down here again, right here. So a lot of women, it's really important to note, and thank you for saying that, it's important to note Jackie had another pregnancy. This may be dormant in women, and they have symptomatology. They think that it's going to be there forever, or they don't realize, like, hey, I have a lot of junk in my trunk that I didn't get fixed the first time, and it's really important to get that evaluated so that they can have the best prognosis with their pubic pain the next time if you had it on your first. So right in there. Wow. Yeah, isn't that crazy? So what they feel like are vitamin E capsules. The other caveat I want to tell you is sometimes people have non-traditional pubic pain. Sometimes they'll have the pain in the muscle, the crisscross applesauce muscle, I call it, the obturator. So you want to evaluate everything. So if she's saying, I have pain into here, right? We want to make sure that we come down into here. That's also tight. Feel that? Mm-hmm. So I'm going to follow it. And those have a tendency to bruise. So you have to warn her, like, hey, you don't want to really dig that. But it almost feels like a cable. Feel that right there? But the money is right where it approximates the pubis, like where it attaches. Feel that? That's awful. The other thing that I want to warn you during your evaluation that I wasn't taught in school is when you do this, do it for me again, push in. Sometimes you'll hear a pop down there, which scared the bejesus out of me the first time that happened, the patient and myself, because I didn't know it was going to happen. As I mentioned, there's a disc in between the center, and that will let a release or a pop. The patient has a lot of relief with that. The one thing that you also want to be careful is the sensitive structures at the center. So again, we're focusing on the center, but you want to make sure you don't go down too low and hit the patient in a very private area that would be awkward for both of you. So you really want to be mindful of staying on the bone like a tightrope and not straying anywhere else. One thing that you really need to educate a patient on after you even do an evaluation is ice. As I mentioned, this is a very bloody bone. It's a very sensitive area. You want to make sure that you're instructing them to ice and to use some deep ice so that we get some of that swelling out. And that's how you evaluate and also treat the pubic area.